Hi, I'm Michelle Grazoulis, and I'm president of the foundations at Rochester Regional Health. Thanks for joining me today. I am so happy to be joined today by Dr. Patricia Hughes, who is a bariatric surgeon at Rochester Regional Health. Hi, happy to have you here.
Thank you for having me.
And I must say she is the only female bariatric surgeon in the region, so high five on that one.
Thank you very much.
Nice job.
Thank you.
Representing well.
Yeah.
So Dr. Hughes joined us in September of this year, and since her arrival, it's allowed us to expand offering bariatric surgery, not only at Rochester General, but at Unity Hospital as well. So we're going to talk about that, but so glad that you're here.
Thank you.
And want to spend some time today talking with the audience about bariatric surgery. So I'll jump in on the questions in just a second. In the meantime, as always, if you have any questions, please feel free to write them in, and we will ask them during our conversation. So let's get started. Actually, I want to ask you what I always ask all my physicians that I get to talk to. Tell me about how you ended up becoming a bariatric surgeon. What drove you to choose that as your practice area?
That's a great question. It's often I get asked a lot. So I think, going in through general surgery program and residency, I realized that I wanted to have a focus. And when we started seeing bariatric patients at our hospital and doing different rotations, I kind of gravitated towards that. And, what really kind of solidified it for me was the fact that, seeing patients post-op and then 1 year out and how much impact you can have on patients. Yeah. And now they're no longer taking their diabetic medications. They're off half their blood pressure medications. They no longer have sleep apnea. So I think the coolest part is being able to cure medical issues with surgery. Yeah. And so why wouldn't you want to go into bariatrics?
Yeah.
Yeah. It's not
why,
but why not?
Yeah.
So that's why I like it.
That's interesting. So this is probably a very emotional type of surgery for people to consider because I would think most of the time it's by choice, right? So someone chooses. Yes. Clearly there's health issues associated with being overweight. But let's start with, what are the fears and reservations that you most often hear about people considering this type of surgery?
Right. So I think there's a lot of people who are overweight already have this anxiety about going out in public and even asking questions about it. Yeah. So even when we put on seminars, I think one misunderstanding is people feel when they go to a seminar, they think they're already tied into our program. But people have to understand that the seminars, to get information, many people have to go to maybe one or two, at least two, to get comfortable with it. And I think that's one misconception. I think another one is people feel like, oh, I can handle it myself, or I'm not that sick. But we see people who are working full-time, 40 hours a week, have children, and still have an elevated BMI and maybe one or two medical issues that would still greatly benefit. Yeah. And it's not just the super morbidly obese or super very sick. It's, we help people from age ranges from 18 to 70. So I think it's all encompassing, which I think people need to realize.
I know two people personally who have had bariatric surgery, and I know from knowing them that it's transformative in terms of
it's amazing.
It's really changed their lives, which makes makes you happy when you love someone and you see them able to feel
Yes.
healthier and better and all those things. So let's talk about some of the positive health benefits. I want to help the audience understand, why would someone consider this, and what ultimately are we trying to achieve by helping them? It's not about being thinner to necessarily look better. It's so much deeper than that.
Right. So right off the bat, if you look at what's changing in the research that's coming out, the number one cause of fatty liver disease is no longer alcoholism, but it's actually obesity. Your liver is now transforming into one giant fat globule. It's like liver cells are being taken over. And leading causes of cancer for men and women, various types of cancer, colon cancer, esophageal cancer, it's obesity. So even taking down your risk factor for getting fatty liver disease or even liver failure, and decreasing your risk of getting cancers is losing weight. But many people need extra help doing that. It's not simple. There's no one solution. Yeah. And then people who are diabetic, getting off of diabetic medications, regulating their insulin much better through various surgeries that we perform, blood pressure, improving that, and even their sleep apnea. Yeah. So it's a lifelong process, but besides that, it's also, getting off medications, seeing less doctor visits, and overall maintaining a healthier lifestyle.
And I would imagine that the psychological impact also of feeling better is such a huge part of it as well.
Exactly. And people, being able to play with their kids, going on vacations, going on cruises, you don't feel like you're going to be a burden to your family by having to stay back. And many people don't want to go on vacations because they feel, they're going to be a burden and they don't want to put that on their family. So they don't end up going on vacation, cruises, or things that they can enjoy. And life is, you only have one and you have to enjoy it. And if I can help people do that, that's amazing to me.
Yeah, it is. I can tell by just watching the smile on your face. So I want to talk about the once you make the decision, but I think one of the questions I have is, what's the general guidelines around a point in time when a primary care doc would say, hey, I think it might be worth it for you to consider this? Are there general guidelines or rules around how overweight you need to be a candidate for it?
So we go in the guidelines of BMI, which takes into account your height and your weight. So your BMI has to be 35 with 2 medical issues, or 40, and that's it. All you need is a BMI of 40 and not have any other issues.
And for those listening who might not know BMI, can just say what it is, just because we never know.
Body mass index.
Thanks.
And it takes into account your height and your weight.
So it's a measure of how much, not whether or not you have the right proportion of fat to muscle, right? In general?
Or just it's a ratio of how much weight you have according to your height. If we just looked at weight, someone who is 6'2" could weigh 200 pounds, but someone who is 5'2", who is 200 pounds, that's much different.
Okay.
So if you're going with a BMI of 35 and at least 2 medical issues like high blood pressure, diabetes, or you have a BMI of 40 and you don't have any medical issues, those are the things that we look for. And then medically, those would be appropriate. And it's also based on what kind of insurance you have. So not only is it taking into account the medical parts, but what kind of insurance you have and making sure you call your insurance to make sure it's covered.
So I always like to ask this question and sort of help guide the audience in terms of how they think about it. So is the first conversation one that you start with your primary care physician if you're the patient? Because they're probably checking BMI. I mean, I know my doc does.
Right. So you can, but some people take their health into their own hands, and patients are their best own advocates. Mm-hmm. So if you don't feel comfortable talking about it to your family care provider, you can Google BMI and see if you fit. Come to one of our seminars, and then you can make an appointment with us. You don't necessarily have to go through your primary care doctor, which you can, and that's great. But you can also, start advocating for yourself and go to one of our seminars and to see if you meet those qualifications.
Okay. So before we jump into where you start, what do the initial appointments look like, and the surgery and recovery, I want to just stop for a moment and feel if there's any questions. Okay. I'm here today joined by Dr. Patricia Hughes, who is a bariatric surgeon at Rochester Regional Health, and happy to have you here talking with the watchers today, the audience, about bariatric surgery. So let's talk about, what does an initial appointment look like? Let's start to move somebody through this kind of journey from the actual surgery perspective.
Right. So say you've gone to our seminar and you are interested. We'll likely call you in the next couple of days to make sure you follow up to set up that first appointment. After that first appointment entails meeting with our amazing nurse navigator, Jen. And Jen is going to sit you down and walk you through the process. It's very overwhelming at first, and the information you get at the seminar, you get a lot of information. So I think it's amazing that we have a nurse navigator.
Absolutely.
I like to call her our Jen or my Jen. And at that visit, the physicians are likely in the office, and then we'll meet you as well. And then you'll meet your surgeon way prior to the procedure as well. So once you meet with Jen, you go through and we start setting up appointments for you, and we take you through the whole line of where you have to go from step 1 to 1 year out. We go through the whole process, which includes meeting with our nutritionist, meeting with the nutritionist group sessions in private. If you need more, then you can meet with our nutritionist more. We also have group counseling as well, support groups.
Okay.
And then halfway through the process, you'll meet back with the surgeon, and then we set up an endoscopy, just looking inside your stomach to make sure there's no issues. And then from the patient part, making sure that we get all of the clearances from your primary care. Do you have a heart doctor? Do you have a doctor who manages your diabetes? We want everyone on board because obesity affects your whole life. So every doctor that you have, we want to make sure everyone is on board and agrees to the process.
That's great. That's great. On average, what's the time? I know it's only an average, but in general, if I went and met with somebody next week, and all things went according to plan, when might I have surgery?
So though usually the process is 6 to 8 months. So it takes 6 months. That is regulated by insurance. Most insurances require 6 months monitored weight loss as well as meeting with a nutrition. And then once you meet that 6 months, then it's getting on the schedule.
So that gets at the next question I was going to ask you. So part of this process is structured changes in your diet before you actually move through to surgery. And then after, you mentioned that as well.
Right. I think it's way too much for someone to be expected to go through a procedure and then learn how to eat differently. That's too much for our brains to comprehend. So I think it's really beneficial to have that process prior to learn what to eat and as well as how much to eat. And not only are you training yourself, but it's really important to incorporate your family into this, because then you can already start changing the lives of your family and of your children, and you stop perpetuating the bad eating habits and then are raising a whole healthy family. And it's important because this isn't a diet, but it's a lifestyle change.
Yeah. So let's talk about post-surgery. What's the surgical recovery like? Because it's pretty extensive abdominal surgery, right? It's not done laparoscopically, or is it?
So we do it laparoscopically. And even say you had surgery, you're getting out of the OR right now, tonight the nurses would be getting you out of bed, moving you around. There's no laying on the couch when you go home. You have to be moving. Yeah. So it is invasive surgery, but there's no time to rest. We make you get up, and I'll check. I'm like Santa Claus.
And I believe her after sitting with her for 20 minutes.
Right. So I'll know.
And if it's not you, it's probably Jen that's going to check, right?
Exactly.
We have found, I just want to mention this too, that you mentioned the nurse navigator and the value of it. We are finding in so many other clinical areas as well the benefits of having a navigator to help people move through the process, because there's complexity and it can be overwhelming. And the better we make the process for patients, the better the outcome. So let's talk about where we have practices. So Rochester Regional Health. I know you're new, but this is a good quiz post your arrival in September.
I'm a good studier.
Good. So let's tell everybody, what does a bariatric program look like at Rochester Regional Health?
So at Rochester, like where else do we go and our locations?
Tell everybody what we know.
The two places where we perform surgery are at Unity and at Rochester Regional Health.
Rochester General Hospital.
Sorry, yes.
It's okay.
Rochester General. That's my newbie coming up. However, we do see patients in Lockport and in Newport. I said Newark.
You got it. We're helping you. Don't worry. Keep going. You're doing great.
So we see patients in the offices at those two locations, as well as do their upper endoscopies prior.
Perfect.
And then we perform the surgeries down here. And I think that's crucial because many of our patients don't live in the area. So it affords them to be able to go closer to home for their initial visits and that brief 1 day, 24-hour, like not even 24-hour endoscopy.
How long is the hospital stay typically?
Usually for a gastric sleeve or a bypass or even a duodenal switch, it's 2 days.
Okay. So great. What your point, I think it's a very important one, is people can be seen across the footprint of Rochester Regional Health, at Newark and in Lockport, obviously at General or Unity for pre-surgery stuff.
Yes.
Surgery occurs at Unity or RGH.
Yes.
But then their post-surgery follow-up can be back in their in their
comfort zone, which is really crucial.
Yeah. So I'm really also curious about, it seems to me from just what I've learned about this and from talking to folks I know, we have we have an extensive integrated approach to this. Is that unique to what happens in other places in the country?
I think we're unique because, with bariatrics in general, you have to have a team approach. So and I'm just one member of that team, and I realize that my part of surgery is just one aspect of the process patients go through. So we have the nutritionists, we have the nurse navigator, Jen, and we have the patients go through the whole process with all of us, because it takes a whole village to raise a child. It takes like a whole team to help someone make such a drastic life change.
Yeah, but so significant. The impact is so significant.
Yes.
What haven't I asked that you think it's important for people listening who might not know a lot about it or be curious to know?
So I think one of the things that stands out about our practice is that we do the laparoscopic gastric sleeves as well as the bypasses But we also do revision type of surgeries as well. So if someone already has an existing sleeve, they can also transform into a different procedure, such as the switch or a bypass.
So I'm going to stop you there because
Yes.
I want to make this real for people. So just in very layman's terms, just describe kind of the
Sure.
options. So what's a sleeve? What's the switch?
Okay, so for a gastric sleeve, it's imagining that your stomach is in the shape of a football, and we
Yep.
turn it into a banana.
Okay.
So it's restricting how much you are able to take in. It's only a restrictive procedure. It's not malabsorptive, which means calories you take in, you're going to absorb.
Okay.
With a gastric bypass, now your stomach, we make it into a little sized golf ball, and we also switch intestines around. So it's restrictive because now your stomach is a little golf ball, but also you're not absorbing as much as you would. It's also malabsorptive because we're switching the intestines around.
Excuse me.
Yeah. And then the duodenal switch is kind of it's a hybrid between making your stomach into a banana and then also switching your intestines around. So,
Excuse me, keep going.
so which one do you pick? You know, you go to our informational seminar to understand, and then this is why you come in and speak with us. We learn everything about you, ranging from, medical history, your plans in the future for having a family, and that all of those components help us decide which procedure is right for you.
Okay. So talk to me a little bit about some of the other physicians. I know there's Dr. DiBenedetto and
Yes.
Dr. Gandhi
Yes.
and yourself. Those are the three physicians that make up our bariatric practice?
Yes.
Okay. And then there's the staff of the nurse navigators and then the other clinical teams that support sort of surgical procedures.
Right.
Okay.
Talk about the two of them, like the three different approaches,
Sure.
the expertise.
So Dr. DiBenedetto and Dr. Gandhi have been here for many, many years. They're great mentors for me. And, we often do procedures together. And, it's only going to grow from here with their expertise and then me coming right out of fellowship. I think it's really exciting.
That's great. It's great. I mean, and I do know both of the folks that I personally know have had their procedures done at Rochester Regional Health, and I know it's been an amazing experience. I want to ask you too, so you talked about the seminars. How can people who are listening find out about the seminars if they are curious and want to learn more?
So you can go to the website as well as on the Facebook page. There's always the seminars listed.
Okay.
And then also to sign up, you can call 922-LINK,
Okay.
and that will give a listing of the seminars and to help you sign up as well.
So what I've learned is that if you think that this is kind of how I would summarize it, if you either feel that you might be a candidate or know you are, first thing that probably is a great way to get smarter at it is to go to one of the seminars.
Yes.
You could do research online, but it sounds to me like what makes it less intimidating is to go to the seminar
Definitely.
and see people but you're not obligated, right, is what you were saying.
Exactly.
And then that will get lots of questions answered, and then people can start to move through the process.
Yes.
Great. Phil, let me pause. Anything else came in online? Okay, so I want to thank you very much for not only the work that you do, but for being here to talk about it. I think it's a really important and meaningful topic to discuss because there's a whole lot of social baggage around
Yes.
having surgery to lose weight, but it, for so many reasons, is so important. And so I applaud you and Dr. DiBenedetto and Dr. Gandhi for the work that you all do and the whole team. So thank you very much for being here. Again, Dr. Patricia Hughes, who, as I said when we started out, is not only a bariatric surgeon at Rochester Regional Health, but the only female bariatric surgeon in the region. So we're happy she chose us and look forward to getting to know you better. And thanks for spending some time with us today.
Thank you for having me. Thank
You're
you.
welcome.